Hi, my name is Anna and I am 21 and I got diagnosed with Bell's palsy on November 22nd of 2016. I decided to film this video just because I feel like a lot of people don't know what Bell's palsy is, how it happens, like what kind of recovery you can get, if you can recover from it, if there's medicines that help you with that, what causes it, and how your life affects when you have Bell's palsy. So for me, it happened maybe a few days before. November 22nd of 2016 was a Monday. A few days before that, I started feeling like I was getting a cold. I was just having like ear pain, and I felt like I was getting a cold, like I said before. And I didn't really pay attention to it. I was just working at the time. I thought, if I keep having that ear pain, then I would make an appointment with my primary doctor and go see him and tell him that I think I'm getting an ear infection, because the pain was from behind my ear all the way down to my neck. And so I just kind of put it off, and I was actually not at home when that happened. I was staying in another place, just watching over, dog sitting. And so, my weekend was okay. Like, I just kept having that ear pain, and I thought maybe it would just go away. So I never really went to the doctor. So I kept saying to myself, like, I have to go to the doctors because I think I'm getting an ear infection, but I didn't really listen to myself. And so then I went to sleep on Monday, and it was painful, like sleeping like on my side, because the pain was like so bad. So then Monday morning comes, and I get up, I'm gonna brush my teeth, get ready for work, and I went to go brush my teeth, and when I went to spit out, the toothpaste and rinse my mouth, I realized that my tongue was sticking out on the opposite direction. So I have Bell's palsy on this side. You could probably tell more in camera than in real life itself. So yeah, when I realized that for some reason my tongue was sticking out from the opposite side of, or it wasn't just going straight, like I couldn't, this part was more like numb. Now I can move it a little bit more, but that's how I realized there was something wrong. And I thought maybe like, I don't know what I was thinking. I didn't really react until I realized, like when I wake up, I'm a little swollen. So I thought maybe it was just that, and then, I didn't really think about it at the moment. And then I guess as I was waking up, I realized more that something was wrong. And the fact that I couldn't like really move my face, and it was kind of like hard for me to talk even more like clear. And so at some point I freaked out, and I was like, oh my gosh, this could be a heart attack. No, a stroke. There you go, stroke. Because I know like one of your sides like will get paralyzed, and like the pain was so bad that it was going down my neck, going towards my like arm, and I was like, this is probably a stroke, like I'm getting a stroke. So what I did was I called somebody from work to let them know that I was going to the ER, because I didn't really know what was happening. I just knew that my face was paralyzed, and days before that I was just having ear pain. So I went into the emergency room. They took me in fast, I guess because they thought I was having a stroke, or it could be stroke. So they took me in, they did some blood work. I believe I had a CAT scan. I guess they just wanted to make sure I didn't have like a tumor or something. But everything came out fine, and the blood work would take a day or two to find out what it was. It was possible that I might have been like infected by a tick, and that could have been it, or they weren't really sure. They couldn't really diagnose. They said that it could just be like Lyme disease or Bell's palsy. and I was just, I don't think I was conscious of what was happening. I wasn't crying. I wasn't like obviously happy. I was just, I guess, shocked that everything like that was happening. So I was there for maybe a few hours, and there was no signal at the time, like with my phone. So, right before I was going into the ER, I had called my sister and I told her what was happening to me. She came to the hospital. My mom came to the hospital. My sister-in-law and my brother came in, and work wanted to know what was going on. So, I didn't stay overnight. I actually was discharged maybe 4 hours later. And they told me to call back to let me know whether it was Lyme disease or it was definitely Bell's palsy. So I work for attorneys, so they know doctors, and they actually referred me to a doctor who's a neurologist, and they actually got me in because that was like like they were going. It would have been a long time for the doctor to see me, to get an appointment with him and meet with him, and for him to diagnose me. So they set up the appointment. I went probably a day or two later. So I went to the neurologist, and he had told me that it was Bell's palsy. He did some testing, and one of the things that you get from Bell's palsy is I think you lose taste in your one side of your mouth. So half of your mouth would taste and the other half wouldn't. And then loud noises would bother you, like it would hurt. So I know they gave me steroids at the emergency room. And then I think they also prescribed me some medication. I think, more steroids. So I was taking about 10 pills at some point, a day. And I remember just sleeping a lot. And I wasn't really hungry, but I would eat, before I take my medication. And then I think the neurologist just gave me more medications to take. So that's what happened. I just literally woke up one day and I was just paralyzed. And the neurologist says that there's nothing that really causes it. There's nothing. He said that a lot of stress could trigger it, or if you get if you start getting cold, sick, like a cold, or then that could also trigger it. It's just like anything, like any other disease. It wasn't really that I was exposed to something. It was just something that triggered it for me to get Bell's palsy. So I think at that time I was going through a lot of stress and other things, like emotional things, and I think that might have weakened my immune system, so it probably triggered the Bell's palsy. And so I guess one of the signs, at least for myself, because I feel like every case is different, when I got Bell's palsy, I looked it up in YouTube. I tried to do my research and see what it was, if there was anything that helped, or anything, because I think that as a girl you care about how you look, and how other people will look at you, especially if you've never had this and you're pretty young. So those were the signs. I just had ear pain, as if I was getting an ear infection. My recovery, I guess every recovery is different. I don't think I recovered fully. Like I said, I look normal in real life, than in pictures or videos, as you could probably tell in the video. It looks like you could tell. And I feel like it shows more when I'm either tired, stressed, or overwhelmed, or something. I'm not happy and relaxed. So my recovery was okay. I think it all depends on how I was feeling, stress wise and emotionally. I know every experience that I've seen in YouTube was different. There were some girls who obviously did YouTube and they got that. They look fine, they look like they recovered fully. There's a lot of things in the internet that says that helps. What's it called? The needle things. What are they called? acupuncture, and like this all these other stuff. I didn't go to acupuncture just because I don't really like plan on doing it. I don't know, I just didn't do it. But overall, I think my recovery was okay. I don't know if I would have done acupuncture. Maybe that would have helped me recover fully. And you know, obviously it has affected me in different situations. Like sometimes I don't feel comfortable with myself, or I don't feel confident, especially when I feel like it shows more. But I don't think I've let it get me down all the way. I think that I just have to admit that maybe it's something that will go away maybe eventually, or I'm just gonna have to live with it for now. But I do try to just not stress myself. I don't do anything to make it worse. And I just, you know, I really can't do anything to get rid of it, you know. Hopefully my nerve heals, or it just becomes better, or maybe I'll just get used to it and I won't realize that this side is a little bit more droopy. So that's pretty much it. I went back to work maybe a few weeks afterwards, and you know, like I said, I don't know if it's just because they were trying to make me feel good or not, but they said that it doesn't really show. So I don't think people treat me different. I think they just treat me the same. I think it's just my self-conscious, you know, because I know and I feel it. Like maybe if it doesn't show, I feel how sometimes my face is tense, like, you know. So I've gone to a plastic surgeon, and he has recommended me maybe to make it more symmetrical, especially in pictures. I think it's the main thing that bothers me. It's probably pictures. Like I have to use my good side, which is this right now, versus my bad side. It just shows more in camera and pictures, so maybe I will do something about it. But I don't think he said it was a filler. I think he said it was some kind of I mean, I could try it out and see if I like it, but he said that he'd probably take my fat from somewhere that I have, and he could just inject it here to make my lip a little bit more like up. So yeah, I mean, and for pictures I'll just have to use my good side. So most of the time I just like, whenever I take a picture, I just go like that or something like that. But obviously I can't like choose all the time. I think sometimes you just have to live with it. I don't think I was very photogenic anyway, like before this. So, and yeah, so I've just trying to get back into working out, accepting who I am now or how I look. I still like to dress up, and I still like to put makeup on. I don't really have makeup on today, but yeah, I still try to do everything that I used to do before. But it definitely has changed my mind in the way I look at people, and I respect the people more that have, you know, conditions that probably they weren't born with, or if they were born with it, and you know, they're still happy, cheery people that are content with what they have, and that doesn't stop them from, you know, working out, going to work, I don't know, dressing up, you know, having friends, going out, having fun. So that's what happened. I honestly don't think I will get better. I think that maybe I'll just be like this. I do try to do some exercises. Like I know that they said chewing gum will help a lot, like when you first get it, you know, like it's stimulating it, maybe put in some kind of lotion and just doing circles, like, and sometimes like when I feel it, like when I'm stressed or something, I try to find a spot where it makes me feel better. So usually I have, like, sometimes it feels sore here. I think before I used to feel like worse, but within weeks after I got Bell's palsy, I started feeling like twitching here, and so like I was able to kind of move. Like you see how this side is the good side, this side is a bad side, but like, you know, like I'm capable of blinking. I think before it was like, you know, more weird, but I have some motion in it. I feel like sometimes when I do like circles in my face, it helps. And that's pretty much it. So it's been a year and 5 months since I got it. So I decided to just do this video because it would also keep a diary as to, you know, a year after. I know the neurologist told me to take pictures every day of my face, but I don't think he ever asked me for them. So I also would recommend to get maybe second opinions if you're not happy with your doctor, especially because this is something frustrating. Like I don't think a lot of people, like when you first get it and, you know, you're like the first person in your family to get it, or you don't really know much people, you know, they just tell you, like, obviously they just want to be comforting and, you know, kind of cheer you up, but sometimes it's just better to, you know, try to be positive instead of, you know, bringing yourself more down. So, I'm new to making videos like this, so, I don't know if I'll keep making them, but for now I'm just gonna keep a diary of my recovery after a year and 5 months, and we'll probably upload another video soon. I don't know. I just decided to do this video because I feel like a lot of people also have questions. I know it probably wasn't very informative, but I'm also just doing this for myself and for whoever gets palsy, you know, to know what really happens, because there is scenarios where you don't recover at all, and it could be much worse where you don't get any movement at all from your face, and you're just, and another thing is, like I said, in person it doesn't look as much. Like my face is not as droop as other people like have it. I don't know why in camera it shows more, but it doesn't really show like a lot. I think in camera it does. Like right now as I'm looking on the camera it doesn't show, but I think like when I look back, when I put stop and I look at the video, I could tell. Also, like my eyes lower, but it does blink. I think before it didn't blink. So like I said, maybe just with time it will like heal or maybe get better. So until next time.